With Enhanced Affordable Care Act subsidies set to expire at the end of the year, millions of Americans who rely on marketplace coverage are facing steep premium increases unless Congress intervenes. An estimated 22 million people could see their monthly costs double or worse. Against that backdrop, House Speaker Mike Johnson, under pressure, unveiled a last-minute Republican health care package last night as lawmakers race toward the end of the legislative calendar with no agreement in sight. Johnson's proposal arrives as Republicans continue to reject extending the enhanced tax credits created in 2021 to help lower-income and middle-class Americans afford insurance outside of employer-sponsored plans. Those credits, expanded during the COVID-19 pandemic, have been central to stabilizing ACA enrollment. Without them, coverage will become unaffordable for many families. In announcing the package, Johnson said Republicans are focused on the real drivers of healthcare costs. The legislation, more than 100 pages long, centers on long-standing GOP priorities, such as removing and not replacing Obamacare, rather than preserving ACA subsidies. It expands access to association health plans, allowing small businesses and self-employed workers to pool together to buy insurance, and increases oversight of pharmacy benefit managers, middlemen accused of driving up prescription drug prices. Critics say these plans often offer weaker coverage than ACA-compliant policies, leaving consumers exposed. The PBM provisions aim to increase transparency, responding to bipartisan frustration over opaque pricing practices that have hurt independent pharmacies. The bill also references cost-sharing reductions for some lower-income ACA enrollees, but those changes wouldn't take effect until 2027. Notably absent from Johnson's proposal is any extension of the enhanced ACA tax credits. If they lapse on December 31st, most marketplace enrollees will face dramatic increases in out-of-pocket costs beginning early next year. Time is running out. Earlier this fall, Democrats unsuccessfully pushed for healthcare negotiations during a prolonged government shutdown. This week, the Senate failed to advance both a Republican healthcare framework and a Democratic bill to extend the subsidies. As Congress prepares to adjourn, there is still no consensus solution. Donald Trump, speaking at the White House, again promised a better alternative to Obamacare, suggesting direct payments to help Americans buy insurance rather than extending subsidies. He offered few details. The Senate Republican proposal that stalled would have funded health savings accounts with annual deposits of $1,000 for adults and $1,500 for people aged 50 to 64, amounts that would not even come close to covering the looming premium hikes. The House plan doesn't appear to include such accounts. Johnson's approach has placed politically vulnerable House Republicans in a difficult position, particularly those representing swing districts. Frustration over inaction has driven a group of more centrist Republicans to work with Democrats to pursue temporary subsidy extensions through alternative means. Several bipartisan discharge petitions are now circulating, a rarely successful tactic that bypasses leadership control by forcing a floor vote if a majority signs on. One petition, led by Republican Brian Fitzpatrick, would trigger a vote on a 2-year subsidy extension, paired with anti-fraud measures and PBM reforms. Another, introduced by Democrat Josh Gottheimer, calls for a 1-year extension with tighter income eligibility rules. Both have attracted enough Republican support that they could pass if Democratic leadership backs them, though House Minority Leader Hakeem Jeffries has not yet committed. At the same time, Jeffries is promoting a Democratic-only discharge petition for a clean 3-year extension. Republicans have made clear that such a proposal has no chance of passing the Senate. These maneuvers underscore a deeper crisis. Republicans have paired opposition to ACA subsidies with major Medicaid cuts, moves that threaten coverage for millions of seniors, people with disabilities, and children. In states like Michigan, where Medicaid covers nearly 40% of children, the consequences are already visible in rural hospital closures and strained local healthcare systems. When people lose coverage, they still seek care, often later, sicker, and in emergency rooms, shifting costs onto everyone else. At this breaking point, incremental fixes are no longer enough. The US carries around $220 billion in medical debt, a burden that could be erased for a fraction of that cost. But debt relief alone does not solve the root problem, a system that allows people to accumulate crushing bills simply for getting sick. The solution must match the scale of the crisis. Medicare for All won't guarantee comprehensive coverage for every American without premiums, copays, or deductibles. It would, however, protect people from losing insurance due to job changes, age limits, or life disruptions, while still allowing employer or union plans a supplemental coverage. By eliminating private middlemen, simplifying billing, and expanding the government's power to negotiate drug prices, it would lower costs system-wide. Aura Frames is the hidden gem that becomes the favourite gift long after the wrapping paper is gone. And maybe there's someone in your life that deserves an extra special gift this year. With Aura Frames, you get unlimited free photos and video. Just download the Aura app and connect to Wi-Fi. You can preload photos before the frame ships and keep adding them from anywhere, anytime. And there's a gift box included. Every frame comes packaged in a premium gift box with no price tag. Don't wait. Win the holidays now with Aura Frames. And for a limited time, save on the perfect gift by visiting auraframes.com to get $35 off Aura's best-selling Carver matte frames, named #1 by Wirecutter by using promo code 5min at checkout. That's AURA frames.com, promo code 5min. This deal is exclusive to listeners and frames sell out fast, so order yours now to get it in time for the holidays. Support the show by mentioning us at checkout. Terms and conditions apply. Expanding Medicare to everyone would strengthen the program by broadening its risk pool and would free Americans to change jobs or start businesses without fear of losing their health care. After years of instability and half measures, guaranteeing health care as a right seems to be the only path forward that truly addresses the crisis facing millions of families today. Top healthcare executive John Driscoll warned that allowing the enhanced ACA subsidies to expire would amount to a costly act of self-sabotage, driving millions into higher premiums, lost coverage, and deeper medical debt. Drawing on Congressional Budget Office estimates, he notes that roughly 24 million marketplace enrollees would see sharp premium increases, and about 2 million would lose insurance altogether, triggering a ripple effect throughout the system. As coverage erodes, people don't stop needing care, they delay it, they arrive sicker, and they generate uncompensated costs that hospitals and insurers ultimately pass on to households and employers. The result is an invisible tax on everyone else, one intensified by simultaneous Medicaid cuts and subsidy rollbacks that shift costs away from government and onto families, even as recent tax changes disproportionately benefit the wealthiest Americans. International comparisons consistently show that despite citizens spending far more on healthcare than any other wealthy nations, the United States ranks at or near the bottom in overall health system performance, coming in last among peer countries on key measures like access, equity, and health outcomes. I'm Anthony Davis. You can find me on the 5 Minute News YouTube channel and podcast, on Wednesdays co-hosting Uncovered, and on Sunday on The Weekend Show with Midas Touch.